I am Dr. Tunji Funsho. I'm a physician and cardiologist trained here in Nigeria and United Kingdom and a member of the Royal College of Physicians of London. I'm a Rotarian, a member of 1.2 million individuals in all continents and almost all countries of the world coming together to do good in the world. I was named one of Time magazine's 100 most influential people in the world by virtue of my contribution to our efforts through Rotary International to eradicate polio from the world using the polio vaccine. I have led the Rotary polio team in Nigeria in this effort for almost 10 years, and Nigeria has now been certified polio-free. But this video is not about me. It's about what vaccines can do in the context of some false negative statements about COVID-19 vaccine. Almost similar things were said about the polio vaccine. But instead of harming people, more than 15 million children have been saved from paralysis or death. Instead of reducing our population has even increased markedly. It's going to be the same with the COVID-19 vaccine. It's going to save lives. The process of vaccine development and certification is a very rigorous one indeed. From the animal testing to check if it works, to 3 stages of human trials, which further checks its efficacy, but even more importantly, its safety. Thereafter, an independent body of experts reviews every stage of the process to ensure safety and efficacy. By the time it is licensed for use on the public, it has been tested on tens and thousands of volunteers, when side effects are closely monitored and analyzed. If the side effects outweigh the benefits, the trials stopped, and that's the end of the vaccine. That is why vaccines have a high mortality rate. Of every 100 vaccine candidates produced, only 7 will succeed in crossing the hurdle to get clinical trials. And of these, only 1 in 5 would meet the standards of being licensed for public use. So you see, the process of vaccine development has safety as its core. And even after deployment, pharmacovigilance units in all countries of the world and WHO will stop the use of vaccines if the risk attendant to its use outweighs its benefit. So don't be misled into not taking the COVID-19 vaccine. It is saving lives already. There is no scientific evidence that the vaccine has killed anyone, except in recent times, perhaps just 1 case in the United States. But there is no doubt COVID-19 has killed about 3 million and counting. Remember, so far, almost 1 billion vaccines have been administered, with only 1 probable death. So the risk is much less than the benefits. So the benefits far outweigh the risks. I have taken the vaccine and I had mild pains at the site of the injection just for a couple of days, and that was it. Other side effects being experienced by other people are normal and have been seen during clinical trials. These include mild fever, headache, mild flu-like symptoms, and occasionally stomach upset. So what are you waiting for? Go get your vaccine now. I have.